I'm looking forward to what you all are doing.
I'm super excited to be a part of what you guys are doing.
The mold that you all are building is a powerful thing.
I've been watching how you guys have been collaborating. And I just want to applaud you. I'm watching you guys. I'm learning from you. I'm admiring you. So thank you for having me on.
Hey, this is Seth Yolorda.
Yo, what's going on? This is Pastor Noah Weinstein.
This is Pastor Tina Kerger.
I'm Pastor Sean Moss.
This is Pastor JD.
This is Pastor Kimberly Mann.
What's up, everybody? Pierre Quinn here, and you are watching Recharge.
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 Recharge. Recharge.
Recharge.
Recharge.
Recharge.
Recharge. You are watching Recharge Worship.
Hey, Recharge. We are here with a great tip video to help you as we are kicking off our mental health series. I'm tired of being tired, and we have a special guest who is here with us who has so much knowledge to give to help us on a particular topic tonight. And yo, if you wouldn't mind, could you please introduce yourself and let the people know who you are and what you specialize in?
Of course. Well, thank you guys for having me. My name is Dr. Terri Griffith, and I am a doctor of clinical psychology. I specialize, I was thinking of my trajectory, but that's not as important. But right now, as a clinician, I run an intensive outpatient program that treats eating disorders in Baltimore. So specializing in treating eating disorders is pretty complex because it does not discriminate. Eating disorders are the most difficult mental illness to treat. We get all different races, backgrounds, ages, shapes, sizes. I've had patients as old as 76 and as young as 7, and so I love the work that I do. And in the intensive outpatient program, it's considered a lower level of care. So inpatient is the highest level of care where you're in the hospital for 24 hours a day with cameras and with full staff. And ideally, the next level of care is partial hospitalization. And that can be anywhere from 8 hours to 12 hours a day. But then they sleep at home. And then intensive outpatient, we're a 4-hour-a-day program. Right now, because of COVID, we're virtual. And so patients start the program at 3 p.m. They have 2 groups. They eat dinner on camera, and then they have a last group. And then the last level of care is like outpatient. And that's like someone who just maybe goes to see a therapist once a week. So I really appreciate the work, but I'm very, very passionate about providing education in effort to decrease stigma around mental health difficulties. I really appreciate you guys doing this and facilitating this for people.
Yo, thank you so much. Like, we greatly appreciate that, and since you said that you are into providing education in order to help break the stigma, of mental health within communities, especially of color, we specifically want to talk tonight about anxiety. So what would you say in your own definition is anxiety?
So anxiety manifests in so many different ways. So I want to start there. I like to think of it and describe it as a spectrum, right? On the far end is like debilitating anxiety when you can't function or get out of bed and can't get anything done because you're way, way, way too anxious. And the other end might be stress that causes some distress. And so anxiety is really just, the fear of the unknown. Am I going to be able to do this thing well? A lot of worry is involved in anxiety. It's very fear-based. Some people have their anxiety manifest in different ways. Someone might feel heart palpitations when they're anxious. You might feel like your body temperature increases or decreases. You might be jittery. For some people, it impacts their meal completions and how much they're able to eat, whether under eating or overeating. For some people, anxiety might be difficulty focusing and concentrating on tasks. Some people who are very anxious are often labeled as lazy because they can't get things done. But oftentimes they can't get things done because they're overthinking and ruminating and psyching themselves out. And so I think anxiety is the manifestation of all of that. But when it really significantly impacts your day-to-day functioning, that's when you might meet criteria for like an actual diagnosis of maybe like a general anxiety disorder or a panic disorder or acute stress disorder. But I think most people, that the everyday person that's functioning and still maintaining their responsibilities, they might have anxious symptoms, or they might have, a diagnosis of a clinical level of anxiety, but just maybe not being diagnosed yet. And some are able to, function with the support of a therapist or even medication or like a treatment center like where I work at, where they can be there for a few hours a day. I want to normalize that anxiety is something that everyone experiences at different levels. And I find that like my goal is to empower people to learn how to respond to stress versus just reacting.
Yeah.
We tend to react when we feel anxious, and that often it creates this like negative feedback loop and just makes it worse. So like I'm very anxious right now, and I feel my heart pounding because I don't know how I'm going to do when I have to do that speech that I'm preparing for. And because my heart's pounding, now I'm thinking about it more, and now I'm thinking about it more, so my body's responding. Because there's this mind-body connection. And I often teach people that our bodies are like mini computers, and God has created us so wonderfully, right? Yeah. And so because our bodies are built that way, the brain, though it's on our head, it's attached to our bodies. And so the brain sends signals to our bodies, and our bodies send signals back to our brains. So when we're anxious and our body is having this reaction, oftentimes how we respond can really dictate the course of the anxiety, the experience of the anxiety, and how we're able to manage it. And so I think that piece is like really important for people to recognize that, mental illness is real. It's crippling for people. Some people cannot function. However, with the aid of supports, with learning tools, with a therapist, or even medication, it's absolutely manageable. And that's, to me, much better than suppressing it, ignoring it, feeling like I can't talk about it, and it manifesting in bigger ways and impacting everything in our lives.
What are some signs to kind of tell that someone can tell, like, this is an anxious moment? And what is some signs where somebody can say, no, this is anxiety?
Yeah. So that's a good question, because I think sometimes we might overlook or ignore some of the signs. And then, someone might have a full-blown panic attack and be like, how did I get here? Like, where did this come from, right? And so, my goal as a clinician is to really help my patients and the people that I know, my friends and family, just be in tune to their bodies, and to me, the ability to do that is helped by mindfulness. We can talk about mindfulness later, but really just listening to what your body is doing. For me, a sign of anxiety is when my body's becoming really hot. That's also a sign that I'm very pissed. I hope I can say that, Pastor.
Absolutely.
That's also a sign that like I'm really upset right now, right? But then when my body gets hot, then I know, okay, Terri, you're probably anxious. What can you do to help yourself right now, right? Another sign might be racing thoughts, ruminating thoughts. It's one thing to think things. When you're revisiting situations and scenarios over and over in your head and ruminating, right, kind of going in a circle, or feeling very overwhelmed or flooded with thoughts, then that could be a sign that maybe it's more anxious, anxiety-induced. Another sign is thinking about your sleeping patterns. For some people, they have difficulties falling asleep and staying asleep, and that could be a simple thing that could be helped with a sleep hygiene schedule. But for some, it might be something that's consistently happening. And so when you find that you're not getting restful sleep, that could be indicative of maybe some anxiety. Thinking about your weight fluctuations, losing a lot of weight or gaining a lot of weight could be a sign that maybe that there's something there that's getting in the way with you taking care of yourself. Right. And ultimately, if you're not able to maintain your responsibilities, right, going to work, making appointments, being a person of your word, maintaining communication with people who are important in your life, that could be a sign that maybe there's a clinical issue that could be something like anxiety. For some, there's so many specific areas of anxiety, but some people might have a hard time entering into certain environments, like for fear of what might happen. COVID season has absolutely triggered a lot of these in individuals, and that fear is warranted. Even where I work at a hospital, thankfully I'm working remote right now, but I just got an email that another psychologist is positive for COVID and another patient is having to be screened. So when you're working in a certain environment, that anxiety is warranted. But if you're someone who's in a safe environment and you're taking precautions, but still having that fear and those ruminating thoughts about becoming sick, that could be indicative of maybe like underlying anxiety that's beyond what's normative. So those are a few things.
I think that was a great disclaimer to put out there, especially because in communities of color, we typically downplay who can get anxiety, even though our community is probably one of the most anxious, So in order to, help like with anxiety, what is a potential maybe exercise or method or routine that you would suggest that could help someone who, is trying to calm themselves down in the moment?
Yeah, that's a really good question, because that's what I'm most passionate about promoting. These are things you can do when you feel so out of control, right? Because even though we feel out of control and feel overwhelmed, it's often not proportionate to the actual situation or our circumstances, right? Like there's usually things we can do or usually supports we can use to help us manage, but the feeling is so intense. Right. And so one thing that I really preach and I lead workshops on and I talk to people about is mindfulness. And mindfulness is like a coined term that a lot of people use and they use it in different ways. I find that people who think about mindfulness often envision like someone being very zen and like very peaceful, having to go to yoga, but mindfulness doesn't have to look like that. Mindfulness is just bringing your attention into the present moment. What anxiety does is have us buy into the fear of the unknown, things that haven't happened yet, things in the future. And depression is more ruminating about things from the past that are really debilitating and distressful to us, right? The anxiety is very future oriented. So in effort to slow that down, bringing your attention to the moment can be really helpful and impactful for that. So mindfulness that I like to kind of teach people is just thinking about how you can ground yourself through your senses. We all have 5 senses, and grounding is just a way to help you stay present. And you can think of literally an anchor that grounds something in the ground to stay down there, to stay present, and our bodies can do that as well. And so when you think about the 5 senses through seeing, smell, hearing, taste, and touch, you can actually ground yourself, which helps you direct your focus and attention to the moment, which kind of slows down and drowns out those thoughts and worries and the paranoia and the fear of things that haven't happened yet. And ideally, when you're grounding yourself, your brain starts to work, it gets the oxygen, right? And it's like, oh, I don't have to freak out. I can call my colleague to do that for me. Or like, oh, okay, like that deadline is such and such date, but I can move that deadline, you know? And like our brains can actually function and do what it's supposed to do and send a message to our body to like, calm down, relax, you know? And so there's something called grounding through the senses, and I can explain it. I don't have to do it. I don't know if we have enough time for me to actually do it. You guys let me know.
Yeah, we can do it. We can do it.
Okay. So you guys can do it if you're open to that.
Let's do it.
So there's a lot of different mindfulness exercises. There's 2 that I like, grounding through the 5 senses, which I'll do with you all. The other one is mindfulness of loving kindness. And that's much deeper. People are often emotional when they do that one, only because you're really thinking about forgiveness and how impactful forgiveness could be for our emotional difficulty. Right? But in thinking about managing anxiety specifically and staying in the present moment, mindfulness can happen at any time, at any day. I'm mindful when I'm cooking. I'm mindful when I start to feel myself freak out because I know myself so well and I study this and I practice this. I'm mindful, at different moments in my life. You guys can probably think about the last time you drove, maybe from church to home or from the store to home or whatever like that. You can probably imagine that you didn't notice the things around you. Usually we just go, like the route, you just go. You might be on a phone call, listening to music, whatever, but we're usually not mindful. So mindfulness just makes you slow that down and recognize the things that you're experiencing in the moment. So when you're thinking about grounding through your senses, it's called 5, 4, 3, 2, 1. So in the moment, you guys can get comfortable in your seat. As comfortable as possible. As we do the exercise, it's really important to breathe because, like I said, as we're breathing, we're kind of connecting our brains to our brains to our bodies, right? And there's a nerve in our brain, the longest nerve, and it's called the vagus nerve, and that's really built in our brain to help facilitate a sense of calm. So, because we know that's the nerve that does that, we want to activate that nerve. So, in order for that nerve to work, we have to breathe. Our vagus nerve is there regardless. But when we're anxious, what's happening with your breathing? Or holding your breath, right? It's usually shallow, or you're just going, or thinking about things. You're not really focused on your breathing. So we want to use what's in our bodies to help us, right? And so we want to activate that nerve. So the way to activate that nerve is really breathing through your nose and out your mouth. And it doesn't have to be a specific count. There are certain counts, but just for the purpose of this activity, just be mindful of breathing in through your nose and out your mouth, because as you're doing that, you're increasing this connection. You're telling your brain, I need you to work for me. And you're having your brain tell your body, okay, Terri wants you to work for us. We got to do what we need to do to calm Terri down in this moment. And same for you all. So as you're breathing, just be mindful of, as you're listening, be mindful of your breathing. So for the grounding exercise, I want you guys to look in your environment. And I want you to notice 5 things you see. Notice the colors. Notice the shapes. Notice, maybe imagine the texture of those things. Just identify 5 things that you see. And once you notice the 5 things that you see, I'm going to do this as well. I'm looking at, I see my selfie light. I have white roses on my desk, a navy blue couch. I see my remote, and I'm looking at my gold iPhone. So I'm noticing all these things. The idea is that when you're mindfully doing this, finding 5 things that you see, it's hard to kind of get lost in your thoughts about things that are to come that you're fearful of in the future, right? It's hard to say I'm noticing my phone while also thinking about things that I'm worried about, all right? So you're going to notice the 5 things that you see. And now we're going to go, that was 5. Now we're going to go to 4. So for 4, I want you guys to identify 4 things that you feel, and that's for touch, okay? Now it could be the hair behind your back. Pastor Kyle, you have headphones on, it could be that. Something beneath, you that you're sitting in, or something that you can grab. I want you to identify 4 things that you can feel for touch. And again, as you're identifying those 4 things, keep breathing in your nose and out your mouth. If it's something that you can't physically reach and touch, I want you to imagine the texture of it. Oftentimes when I have patients who are panicking, very anxious, we'll have them hold something in their hand to ground, because touch can be very powerful, right? I can feel the ridges in my pen right here and the pointiness of the bottom of the pen, right? So as I'm doing that and feeling the sensation, it's really difficult to get worked up about what I'm thinking about, what I'm anxious about. So identify those 4 things that you can touch or feel. And now we're going to go to 3. Okay. Now I want you to identify 3 things that you can hear. Now this sometimes is difficult because if you're in a quiet room, it's hard to hear things. But right now I live in a loft building. I can hear my voice echoing. I can hear my fan. And I can also hear someone going up and down the stairs next door. Okay. You might hear something out the window in the street, depending on where you live. Or you might hear white noise, but I want you to identify 3 things that you can hear. Now we're going to go to 2. I want you guys to think of 2 things that you can smell. This is another tough one because if there's like no scent in your place, then that's hard. But you might have a scent on you. If you have perfume or cologne or lotion, you might have a candle you can grab. Maybe your spouse is cooking, you might smell the food, right? Maybe your clothes, if you wash your clothes, maybe you smell detergent on your clothes. It could be anything, right? But it's really important to kind of activate smell. Smell is a powerful sense to use to ground. Think about like a eucalyptus or mint candle and how powerful that scent is. Lavender and chamomile, they're known for being very calming scents. Lemon is really known to kind of activate the sense when you want to be alert. And so those are, active scents. But you can just think about what you smell around you or even on you. And the last thing is 1, and that's for taste. If you don't have anything in your mouth, you might not taste anything. If you brush your teeth, you might taste that. If your breath is stale, you might taste that, right? But you can imagine a taste. In the moment, you could taste something. If you find yourself becoming anxious, taste something that you like, taste something that's minty, something that's going to activate that taste scent, okay? So very simply, that was 5, 4, 3, 2, 1. And the idea is to do those things as often as you need to so that your anxiety that you experience is at a manageable place. Right? It doesn't mean that, okay, I did 5, 4, 3, 2, 1, and like now my anxiety's gone. It probably just means that it's come down a little bit to where now you can do something constructive or go to the event that you're fearful of with the support person to kind of help you, or kind of function enough to where you can send that email and that it isn't so debilitating. And all we're learning to do with anxiety management is responding to our distress differently. The triggers and the distress is there, right? And oftentimes, unfortunately, triggers are so unpredictable. Something can happen and I could be triggered right now. But then realizing that I'm connected to my body and I get to respond how I want to and not feel the need to succumb to the trigger or to be controlled by the trigger, that's really powerful. And I think it's enlightening for a lot of people because oftentimes we feel so out of control when we're experiencing something like anxiety, right? And because of the stigma, especially within the Black community and a lot of underserved populations, we don't talk about it. So a lot of people don't know the tools they can use that are at their fingertips. They don't know the things that they can do that are adaptive and more helpful to them. So this is just, a quick exercise that could be used. Even for me, sometimes I feel like I don't have the time to do a whole, anxiety management activity. Like I would promote it all the time, but sometimes we just go, and we want to push through and, just, do the work, without taking some time to even breathe, right? I'm even a big believer in just breathing, taking a breath, right? Because if we're not, then the oxygen in our brain that helps us go and get things done isn't really pumping anyway. And that vagus nerve isn't activated, right? Because we're going. And so we wonder why we're having a hard time and why we're struggling. It's because your body is in distress. It needs you to take a second. And as a community, we tend to take on a lot. And this is like systemic. Don't even get me started about, this idea of having to prove ourselves and work harder. We're known as a culture for being the hardest workers. But that is to our detriment because we are dying. Dying of heart disease, which is in combination with anxiety, dying of mental health difficulties, right? Heart disease is the number one killer. Suicide is the number two in the Black community. And both of those are triggered by anxiety or in connection with anxiety in some way. So it's almost like such a necessity. Just be aware. Yeah. Be aware of how to start, how to hold ourselves accountable, with responding to our distress a little bit differently. Yeah. Right. Yeah. And practicing it definitely takes practice. I appreciate you guys engaging and ideally being able to replicate it in your lives when this comes up for you. That type of anxiety management exercise takes about like 5 to 7 minutes or something like that. If you're just breathing, you can breathe for maybe 3 minutes and then transition throughout your day. You can also journal because journaling is a really good tool as well. It compartmentalizes your thoughts. If your thoughts are racing, putting it on paper and closing it could be really adaptive and helpful. That might take 5 minutes. Yeah. You could pray for an hour and get the tears flowing. And that could be really cathartic for you. That could be used for anxiety management as well. There's so many different tools, but I really advise that people do it as many times as necessary without giving up and feeling like, oh, this is not working. Gotcha. Right? Because what other options do you have? Struggling through that anxiety or doing something that's working, even if it's working, at a mild level, but continuing to do it to kind of help yourself. Yeah. And so it's really up to you, and it's up to the situation you're dealing with and the stress that you're experiencing in the moment.
Dr. Terri, before we go, would you mind telling us where can we find you? Where can we support you? What are you working on that maybe you want to put us onto so we can support you?
Definitely. I appreciate that. People supporting people. So I created a podcast and it's called Chat with Dr. Terri. And the podcast is available on all platforms. I have to say that I do a lot of different things. And so the podcast I think I created a little bit over a year ago. And so there's a lot of episodes already in the archives that you can revisit. I haven't done one that recently. I think the last episode was created a month ago. But for me, the goal is to have that platform that can facilitate tough conversations that we don't like to talk about and things that people deal with, like jealousy, or, trusting the timeline of your life. Of course, thinking about anxiety and depression and things like that, but I really want to have those tough conversations. Usually it's me providing information, and sometimes I've had a few people come on the podcast to share their thoughts on different topics, but that is on all podcast platforms as well as Instagram at Chat with Dr. Terri. You guys can definitely stay tuned and be in touch that way.
Cool, man. Well, listen, we appreciate you, Dr. Terri, for just coming through, hanging with us for a few minutes. We know that everything that was said here is going to help so many people who check this out. Please, if you're watching this or you have watched this is your second or third time watching, make sure you share this video, man. Please share this video. Do the exercises. I know I am. I know Janelle is. We already know Dr. Terri does. So we just hope that, this has been beneficial to you. And we're just starting the conversation here this month in terms of mental health. So thank you, Dr. Terri.
Of course. Thanks for having me.
I'm looking forward to what you all are doing.
I'm super excited to be a part of what you guys are doing.
The mold that you all are building is a powerful thing.
I've been watching how you guys have been collaborating. And I just want to applaud you. I'm watching you guys. I'm learning from you. I'm admiring you. So thank you for having me on.
Hey, this is Seth, your Lord.
Yo, what's going on? This is Pastor Noah Weinstein.
This is Pastor Tina Kerger.
I'm Pastor Sean Moss.
This is Pastor JD.
This is Pastor Kimberly Man.
What's up, everybody? Pierre Quinn here, and you are watching Recharge.
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 You are watching Recharge Worship.